interested in the whole issue of how do we reinvest in health. Our passion, some of you have been with us on the whole journey. I see Don Fisher here. It's only been 20 years. We've been talking a lot about how do we not spend money on things that don't make people healthy, and how do we move money to the things we're not paying for now that would really make a difference in a nation that is not proud of its population health. We are looking forward to having the conversation tonight. We have two extraordinary guests here, not from Pittsburgh, and two wonderful guests here from Pittsburgh.
Choosing wisely, from my perspective, is an empowerment engagement strategy at one level. And how we did that is to ask specialty societies to come up with 5 things where the risks didn't outweigh the benefits. And then we partnered with Consumer Reports at the time and many other consumer groups. So we were engaging and empowering both the patients and the physicians to have conversations about what was necessary, what was appropriate for them. So we built a tool. We built some awareness around the issue, and now we're poised to partner with organizations that can take this to the ground. Doctors are trained to be thorough. Uncover every rock to make sure you've nailed down the diagnosis, rather than thinking about appropriateness. And I think things will change when we go from, why did you do that test, to what was the need for that test, rather than saying, why didn't you do that test? Why didn't you do more, rather than, why do you need that test? That mindset change, I think, is what needs to happen.
Thing that's sort of near and dear to my heart too, that Dan also mentioned. What I love about choosing wisely is that you can use the patient to help keep you honest. If you educate them, and Frank's going to talk a little bit about how we do that, but once you educate them, yet again, you've burned the ships, because now they know, and now they can hold you accountable. And that's something else that we think is really great about this particular initiative.
That day, I heard Dr. Eric Y. from UCLA talk about how they had greatly reduced, over 90%, the number of patients undergoing cataract surgeries in LA who had to go for preoperative visits. And he's sitting there, and I said, this was October 2017. The article in the New England Journal of Medicine in the year 2000 said that there was limited value for preoperative testing for cataract. 17 years later, and I was still being asked 4 to 5 times a month to do pre-op cataract visits on patients, and all my partners were the same. And I said, we got to do something here. And that's when I came back, revved up the next day saying to Mark, we need to do this, we need to implement this. So said to every doctor in the practice, download the app on your smartphone. It has provider-facing and patient-facing materials. It can help with shared decision-making conversations. Every doc in the practice has that on their smartphone right now.
Before I tell you the story, I'll just tell you the 3 take-home messages of this experience that we had starting in Utah maybe about 4 years ago. And the 3 take-home messages are, 1, in terms of value, you can't manage what you can't measure. The second lesson was improving quality drives down costs, which is counter to many people's notion who think that, in order to have better quality, you need to spend more money. Actually, most of our experiences show the opposite is true. And I think that's really at the heart of choosing wisely. And then the third lesson that we learned was just how invaluable this journey that we took in terms of measuring value, which I'll talk about shortly, was in terms of addressing physician burnout, which, as many of you know, is really a crisis in the healthcare field. So
3 qualities of systems where choosing wisely will take hold. If you had to say, these are the kind of systems that are really ready to go after choosing wisely vigorously, what would the 3 characteristics be?
They've already made a commitment that they're going away from volume. That's number 1. Number 2 is that they have infrastructure already established around quality improvement and safety. And 3, they've got good partnerships in the community with consumer groups, with employer groups, and with Karen Feinstein.